I want to move to our introduction of our first speaker. We're really appreciative of the participation of both Dr. Terry Mason and Dr. Julie Morita, who head the county and city public health departments. Their concern about this issue is illustrated by their presence here today. Dr. Morita wasn't able to come until later in the morning. Dr. Mason's able to join us earlier today, but we really appreciate their being here and setting a tone for what needs to get done in our city and in our county. Dr. Mason was appointed the Chief Operating Officer of the Cook County Department of Public Health by Cook County Board President Tony Preckwinkle in 2013. Prior to that time, he served in leadership roles in the Cook County Health and Hospital System and as Commissioner of the Chicago Department of Public Health. The Cook County Department of Public Health serves suburban Cook County, including 125 local municipalities and a large urban population of approximately 2.3 million residents. So it's spread out, and the challenge of addressing so many different municipalities is something we'll also be talking about a little this afternoon. Dr. Mason is a nationally recognized health educator and inspirational speaker who champions holistic approaches to health management, and is Dr. Mason's continued vision to transform healthcare delivery through the integration of public health and public medicine to create a population-based strategy to manage chronic disease. And with that, Dr. Mason.
Thank you, Anita and Catherine. Loyola University has continued to be a great partner in organizing the region around lead and healthy homes issues, and I want to thank them for continuing, as they've done in the past, for convening this meeting this morning for all the work they do to help protect children. The water crisis and the slow response in Flint has focused the attention there and across the nation on lead poisoning. While water drove the story, we know that there are many sources of lead exposure. Lead-based paint continues to be a significant hazard in the Chicago and Cook County, and we now see new sources of lead in products like imported pottery, candies, and spices. Whatever the source, lead exposure compromises children's development, even at low levels. And research shows, as previous speakers have already indicated, that low levels of lead are linked to hyperactivity, reductions in IQ, and behavioral problems. As we know, a recent study of almost 50,000 children in Chicago public schools found that the low-level lead exposure lowers the standardized test performances and increases the risk of school failure. The study controlled for factors associated with school performance, including poverty, birth weight, maternal education, and race and ethnicity. Studies in other parts of the country have found similar results. The question remains, what do we do to best protect our children, especially low-income children of color, from lead exposure? I'm glad to be here today to work together to create comprehensive approaches to addressing housing and the health of our communities. We'll talk about the programs that we have in Chicago and in suburban Cook County to address lead poisoning, and in discussing our surveillance activities, lead risk assessments, nursing case management, and policy and education activities, we can identify areas of strength, areas to address, items on which we can work together to make our responses more robust. Again, thank you to Loyola for convening this meeting, and thanks to all of you for your interest in improving the health of our region.